Hi, my name is Stephanie, and I'm an athletic training student at California Baptist University, and I'm here to discuss weight management in sport. The NATA released a position stand discussing proper guidelines for helping your athletes manage their weight during sport. Many sports have weight classifications that were designed to promote safety and equal participation opportunity, such as wrestling, boxing, and rowing. There are many other sports in which weight management can play a role in performance outcome, but where there are no weight guidelines or classifications. These sports are ones such as gymnastics, figure skating, and dance. These sports benefit from a lean body mass, both in skill, ability, and aesthetic judgment. The National Athletic Trainers Association, or NATA, has developed and rated several weight loss and maintenance strategies based on a range of scientific evidence. There are 20 strategies discussed in the position stand that cover topics ranging from body composition assessments, goal weight, the effect of hydration on weight, caloric intake, and a healthy diet plan, and education on dietary and weight management practices. The NATA then rated each strategy using the following system. A, to designate that there are many well-designed experimental or clinical studies to support the strategy. B, to designate that there are some studies that provide a strong theoretical rationale to support the study. C, to designate that the strategy is currently based mostly on anecdotal evidence. Out of the 20 strategies, there were no A grades, 6 B grades, and 14 C grades. This shows that there are not a lot of gold standard research in this area of science. Several organizations, such as the National Federation of State High School Associations and the Collegiate Sprint Football League, have implemented standards for determining safe and effective weight management practices among their athletes. Athletic trainers of these sports teams that have standards for weight management should be familiar with the guidelines and how to advise their athletes to safely meet weight class restrictions. Other sports in which weight and body fat can affect performance, but in which there are no set weight limits or restrictions, include aesthetic sports, such as dance, gymnastics, and figure skating, as well as speed sports, such as ski jumping, cycling, and long-distance running. These sports can unknowingly put pressure on athletes, as coaches of these teams tend to perceive leaner athletes as having higher performance ability, so each athlete strives to be the leanest in hopes of coach thinking they are the best. Currently, there is no scientific principle that supports weight management solely for aesthetic performance. However, aesthetic performance activities generally require a fit body type for higher performance, and judging criteria is objective, which can trigger pressure and therefore unhealthy eating habits in participants. In order to prevent weight management issues among your athletes, athletic trainers should know the appropriate sport-specific guidelines for their team's weight restrictions and how to properly give advice regarding diet, nutrition, and weight management. It is also important to know how to measure body composition to help keep athletes in a healthy weight range. Hydrostatic weighing is currently at the top of measuring body composition and is considered the gold standard method. Clinical methods to assess body composition include skin fold testing, bioelectrical impedance, and near-infrared interactants. Body composition should be assessed using one of the methods mentioned above by trained body composition test personnel. The skin fold method is currently the best clinical method available to measure body composition in athletes because of the ready availability of the necessary equipment and the easy-to-follow protocol. The athletic trainer should be familiar with at least one of these methods and know the guidelines for using that method to test body composition of their athletes. Body composition should be tested twice annually and should always be tested on a properly hydrated athlete. Athletic trainers should work with team physicians and know the safe ranges of body composition for their athletes and the needs of the sport in order to individualize weight and body composition goals for the athletes. Athletic trainers are responsible for informing the athletes of harmful or high-risk findings of their body composition, both overweight and underweight information, as well as nutritional management assessments. Maintaining a healthy body composition incorporates two important areas: a healthy, nutritious diet accompanied by a daily exercise program. Diets should be specific to the athlete's needs and should be discussed privately with trained experts, including dietitians, nutritionists, and athletic trainers. Athletic trainers can help their athletes year-round maintain a safe, healthy diet plan that gives them the energy and nutrients that they need to sustain a healthy body composition and perform to the best of their ability. Athletic trainers should be a resource for supplements, especially if working with athletes in the NCAA, the United States Olympic Committee, and the International Olympic Committee. Exercise programs should be sport-specific as well as useful in maintaining overall fitness. Athletic trainers can help their athletes develop appropriate training methods as well as healthy diet plans. Athletic trainers should be aware of unsafe methods their athletes may be using to manage their weight before competitions. Athletes may fail to replenish lost fluids during exercise, wear multiple layers of clothing to induce sweating, restrict food intake, or use supplements to encourage dehydration and lose water weight. Current research shows that some organizations are testing hydration in addition to pre-competition weight to prevent athletes from using dehydration to make weight. Athletic trainers should educate their athletes on the negative effects of dehydration on performance and discourage this method of making weight, as well as discouraging unsafe and unhealthy eating behaviors such as eating disorders. Eating disorders can occur in both male and female athletes, and athletic trainers should know the signs of eating disorders and how to help an athlete suffering from one. Athletic trainers should use the information presented in this position statement to make themselves aware of the risks of weight management for their athletes. This statement educates athletic trainers on the safe and unsafe methods of weight management for athletes, and this information should be applied in the athletic training clinic.